All set.
Okay, Bernice, do you want to start with opening the meeting?
Yep, that sounds great. Thanks, Rose. Do you want me to give you a minute to put the agenda up, or you're okay?
I'm good. I will do that.
We don't
right-
need it.
No, I'll do that
We
as
don't
we're
need it, but
doing
it doesn't matter.
after roll call. I'll put the agenda up.
Okay. Good evening, everyone, and welcome to our meeting. If we could just take a moment for a prayer followed by the Pledge of Allegiance. Heavenly Father, I just ask as we come together that you will be with our community members, our families, our staff and administration, that you will continue to keep them safe, and that you will give board members wisdom as we make our decisions moving forward. We ask this in your holy name. Amen. We could just stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Rose, if we could just have a roll call, please.
Mrs. Fiorella,
Here.
Mr. Hoke,
Here.
Mr. Gogalski.
Here.
Mrs. DeCiato,
Here.
Mr. Enslin,
Here.
Mr. Gershi,
Here.
Mr. Gambita,
Here.
Mr. Auckland,
Here.
Mr. Wood,
Here.
Attorney Meir,
Here.
Dr. Barrett,
Here.
Dr. LaRosa,
Here.
and Ms. Emmett is here. Madam President, you have 9 board members present. I'll put the agenda on the screen.
Great. Thank you so much, Rose. Matt, like you said, this meeting is to discuss us moving forward. So if you want to go ahead and bring the information that you had from your meetings today, that would be great.
Very well. Rose, do we have anything from public at the moment before we do that?
No, nothing's come in on the email line yet.
Okay, thank you very much. So we had our meeting this morning with representatives from Wayne Memorial Hospital, several physicians. These are our biweekly meetings that we've had since October. I want to say we started those just to give updates and provide various stakeholders with information pertaining to the data that's out there and what everybody's seeing in their facilities. Obviously, with the school districts being on break, there's been a little bit of, I guess, a slowdown on that end in terms of information coming to us since last Wednesday. But today was very informative. It was very, I guess, decisive in my eyes in terms of what the recommendation will be at this point. Again, state data, looking at that data, we're still at the 20% positivity rate, and we're at 600 per 100,000 in terms of infection rates, which the recommendation would be less than 100 and then less than 5% transmission rates to remain in person at a given point. Obviously, we have gone as far as we push the limits, I believe, in terms of getting staff and students safe in school, and we did a really good job with that, and our staff and kids did a wonderful job. After Thanksgiving, we did have an uptick with our own numbers. We had to quarantine several staff and students, as well as have many positive cases after Thanksgiving. But that's reflective of the local data as well as across the state and nation. But the two physicians, Dr. McVeigh and Dr. Cruz, who have been very supportive and very integral in allowing us to be, I don't want to say allowing us, but helping us be open since the start of school, even putting videos on our websites. Today was a little bit of a different tone. Both of them recommended delaying the opening after the holidays. They said having a back-to-back holiday with Christmas and then New Year's and all the gatherings that have been taking place, even though people are not supposed to be, will be a concern over the next 10 to 14 days. They both recommended a virtual opening. They said 2 weeks would be ideal at this point to try to let things settle down and let things hopefully or get people who may become infected time to regroup and isolate as necessary. Their concern was that if we go back in person, especially that first week, what one of them said, many people would become asymptomatic wild spreaders, and it would spread very quickly. So they projected that even if we were in with that second week back, we would have to close buildings anyways because of the amount of quarantining. So that statement was a concern from myself. Again, the staffing concerns, and not just in the school districts, but at the hospitals, at the nursing homes, have been growing more and more of a concern. We've had our issues. We had to close Evergreen a few weeks ago, and we were very close to having to close down our high school, middle school campus just before the holiday break. And that will definitely be a concern, apparently, if cases continue to rise. So with that being said, I know the board asked for data from the beginning of school. So we've had 393 quarantines and 30 positive cases altogether. So in half of those, 15 of those were students. Currently, we've had 36 people that are in quarantine and 8 that are positive cases. And again, half of those are students as well. So I sent the local data to the board today from the amount of positive cases. Now, they did say that the positive cases over the past week have declined. We had 108 in the county this past week. Last week was like around 160. So that has gone down. The one thing they did say, though, is that the cases they've had have been more severe. Even though there are fewer, there are some more severe cases of reoccurring or occurring, excuse me. So the other portion of allowing those 2 weeks, if the board decides to vote that way, to be virtual, it would allow more information to come down from the Department of Health as well as the CDC in terms of vaccinations for staff. Currently, teachers are in the 1A classification for vaccinations, which would be, frontline workers are 1, where teachers would be 1A. We still don't know how many vaccinations we may be receiving. Even the hospitals at this point have received a reduced number that they were told originally, and it's been delayed several days, if not weeks. So we're not certain what the status of the vaccinations are for staff, but hopefully that would give us some time to figure out those details. So that being said, does anybody have any questions at this point, or any questions about the data, anything that we learned today? from the data or the physicians.
Yeah,
Matt.
Matt, sorry, go ahead, Gary.
Matt, so what is your recommendation going to be?
My recommendation would be to go virtual for 2 weeks, completely virtual. Very, very similar to what we did with the 2.5 days prior to the holiday break. All students are at home. We would open the buildings for staff to come in to work from their classrooms in isolation. We would, shut down the faculty lounges, things of that nature. So we don't want anybody gathering. If there are childcare concerns for staff, they would either be allowed to bring their children to their classroom, or we would provide, if we're able to, some sort of supervision to a certain extent. Again, we don't want people gathering. So, and if any staff had any medical concerns or another reason to work from home, we would allow that on a case-by-case basis.
Matt, I have a question about the vaccine. Are other staff other than teachers also considered in this 1A category so that they can be kind of towards the front of the line?
We don't know that at this point. There's been very little information being disseminated about who should be vaccinated first, other than some generalized physicians, nurses, first responders. But even within the hospitals, they received a reduced number than they originally anticipated. So they're trying to figure out who they should vaccinate first, without guidance at this point. Will that be coming in the next week or so? Potentially, but we're not certain.
Okay.
Matt, with the staffing, I know last time you spoke that there was a number that came down for FMLAs. Can you give us a number of teachers in which school they are in? How many?
So we're looking at, we had 11 either on FMLA or sabbatical. We anticipate about 6 more. I have to find that, but at least 6 more in the next few weeks for either FMLA or another reason. Let me pull that up to get out of my screen here. But that's essentially where we're at currently.
And
Bernice.
where's the majority is that coming from? High school, middle school?
Primarily high school had the most, and then it was kind of spread out relatively evenly among the other buildings. There are a few elementary that we're looking at in the next few weeks, though, as well.
Okay, thank you. Does anybody have anything that they want to say? I personally suggest if we could do a week and do it at a week at a time, if that's the route that is chosen, because that will still give us 10 days to get back in on the 11th. And I think from the 31st coming back to school on the 11th, that is still 10 days as opposed to full 2 weeks virtual. But that's what I would like to see. Take 1 week at a time, as opposed to just do 2 weeks right up front.
Yeah, Bernice, I would agree with that. Since our next gathering is going to be January 1st, if there are going to be groups together, which is a Friday, giving a week off and then possibly going back that following week is 10 days from the last gathering. And from what I understand now, they want quarantining between 7 to 10 days. So you're 10 days out, and would probably recommend looking at the numbers within our zip codes to see where the numbers are going between now and then. And, you know, if the numbers are trending up, then we definitely should look to reconvene. If the numbers are going down, I don't see a real reason to go out a second week if our numbers are going down. Zip code wise, that is.
Right,
I
and that's
totally
where
agree
I
with that.
say too. Joe,
I'm sorry.
right?
I'm sorry,
You
Bruce.
agree with
Yeah,
that?
I
I
totally
wasn't sure
agree
if that
with
was you.
Yeah, it is. I'm sorry. It's Joe. I agree with that. I just,
Okay.
the 2 weeks, we've been doing it. We've all been talking. We all are worried about it. We all, are discussing it. And I think if you wait, why wait 2 weeks? Why not wait every week? That's something I mentioned today was just, if we have to have a meeting every week, we have to have a meeting every week. I think that's just the way it should be.
I was on that website.
And
I went on that
personally-
website today. I'm sorry, Bernice. I went on the website today. It posts the numbers by zip code, the amount, and I'm literally going to start just tracking the zip code in our district from today, every day forward for the next, until we reconvene. If we have to reconvene, say the middle of next week, we'll know whether those numbers are going up relative to the general, the area. So
This is Bill. Jeff, I was wondering about zip codes because they aren't confined to our district. For instance, Lake Ariels is 18436 and it goes into Mount Cobb. And Hollisterville is Moscow, 18444. And I'm not sure looking at a zip code gives real accurate information about Western Wayne.
well,
Because of the overlap.
I understand that, Bill. It's
Yeah.
still within our general area, and it's a lot closer than just looking at the entire county or the entire region.
Well,
Right, because I think Honesdale, they have 4,000 some cases. That doesn't even, that's nothing. We have what, 1,300? So I think, to do it to our area is a lot better than Wayne County.
I think some of Western Wayne is in the Homestead zip code. Certain, I don't know how many, but in other words, I'm just wondering how that's going to really give it that accurate a picture. But whatever.
I don't think anything can give us an accurate
No,
picture,
no
Bill,
problem.
but I think it's something at least we can look at. It gives you something to at least get an idea instead of the whole county. I agree with Jeff. I don't think it's a bad idea at all.
No,
And of course, if the numbers are going up, then we're obviously going to do the best for the safety of the district. So this will be a pretty good gauge, I think, just taking a look.
So
I
is
also
the
have to say, I
idea-
have such a problem.
this
Go
is
ahead.
Ethan Wood. Is the idea that we're going to meet every week and review these numbers and make a decision on that? Because just based on where our zip code is going, I'm not sure that that's going to
No, I
be
don't think,
providing the certainty that families need to plan. I would
well,
rather
I don't
take
think
larger
we can
chunks
go
of time.
just by that number. Well, I think people are planning, and I think a week at a time, we are giving people 2 weeks at this point. We closed and went virtual 3 days last week to give everybody the 14 days. And yes, numbers may be going up, but if we're only closing our school, but yet you can go shop at Walmart and Target, what are we doing? We're not doing anything to keep the numbers way down because everyone's still out and about. So
I wouldn't know.
to me, I just don't see, unless you close it all.
Yeah, we're trying to help the problem, whether we can't do it on our own. So hopefully if the other districts follow suit and when everybody is on a similar page, hopefully we can help. I'm okay with a week to start and then revisiting it according to the numbers if everybody else is.
Matt, the recommendation was 2 weeks. Is that correct?
That was the suggestion. Yes, they said, if we could do that to keep people separated for those 2 weeks, give that amount of time for the people to quarantine if need be and die down, we wouldn't have the spreading that would occur as if we were in, of course.
Matt, there,
Well,
this
And
is
I-
Trevor.
if the gatherings,
recommend-
if the gatherings happened over Christmas, Christmas has already gone and passed. And so if there isn't as much gathering on New Year's, we're already going to be 2 weeks out after that first week, which I think there's going to be less gatherings for the New Year's anyway. So I think going the week and then just basing the numbers after that is, again, my feeling the best way to go at this point.
Again, one thing I will reiterate is, these guys were all along, very supportive of us attempting to be in and helping us along the way. And this was really the first time that I've heard them explicitly say, you guys should go virtual if you can. Like if you have that capability, then by all means, they said, just err on the side of caution and be safe. The one physician stated at this point, 80% of his patients had to be turned away at the door because they didn't meet the criteria when they have to fill out the checklist as to where they've been, what they've been doing, are there any symptoms? And he said all of those patients had to be contacted via telephone. So he said it's just they believe these are telling signs that the worst is to come in the next couple of weeks.
And Matt, and I understand that, but I also think it's telling times that people have had it and they're done with it, because the same rules have been in place for 9 months. Stay home, don't go out, don't travel. And so I think everyone's to the point. So my question is, I don't see this getting better.
That is
I
the
don't,
point.
just by 2 weeks virtual.
And I agree with that, Bernice, to a point where they even mentioned that they commented that people are at their wits' end, and they're tired of isolating. They're tired of all the rules. But at the same point, that's also why they're seeing more gatherings occur, which is alarming them.
Well, if they're going to shut schools, then they got to shut Walmart and Target, because it's still going to be spreading. So they
Well,
can't just pick and choose.
And we're not saying that the second week is we're not going to go virtual, because we may. I mean, the numbers may not change, and we can reconvene next week. And it's like, they haven't changed. Things still are trending in the wrong direction, and we just make the choice to go virtual for that second week. But I think just going week to week at the moment is a better process at this point.
And
Right.
I
And
don't
I-
think
I
there
was-
has to be a meeting. I think that could just be easily a phone call and say, Matt, this is where everyone's at.
Well, currently we do have a work session on the 6th, and then the voting meeting is on the 13th. So we can meet next week and discuss it further if you'd like, or if you want to allow me to present the data, and then we could decide that way moving forward. I guess that's up to you guys, but
We have a meeting on the 6th anyway, right? No matter, that's a
Currently.
given meeting. So I mean, I just, how I feel is that, okay, that first week we're going to be virtual, right? And we have a meeting anyway, so we can do the same thing we do that night as we are right now. And like Jeff said before, that's not saying that we're going to not be closed or open either way for the following week. I just think that we go week to week. I mean, that's pretty much, I think, how we really have to do it. That's my opinion.
If anybody has anything to say, now's the time to say it.
I'm fine with that, the way we're talking about it, starting out with a week and then adding if we need to. I would like to say though, Bernice, I get what you're saying about people going out and doing things wrong and not necessarily following the rules, but I think we have to do our part to try to do the best we can. We're not in charge of Walmart or Target. We're in charge of Western Wayne School District. We want to try to make sure everybody's as safe as possible. And I think they have done a fabulous job so far, whether it's luck of the draw or whatever, but I think we've got to do our best to try to help mitigate.
And I think, Rick, I think it should be in the parents' decision. The parents should decide. You know, if
I
you
don't
don't want to
disagree there. I
send
think
your kid to school, then continue on Google Live.
Yeah, and that is a viable option.
And
for
we've
the
always
parents,
had
but
that option.
It's not necessarily
So
for staff.
I'm
and-
fine with the week, and let's do it a week.
Okay, all right.
Does somebody want to make a motion?
I have a
for that?
question.
Oh, I'm sorry. Go ahead, Mike.
Is that Mike?
Yes, I have a question. Now, could we do like a reverse virtual, like Rick was saying, where, some teachers may be afraid to come into class? Could we do like a reverse virtual where the teacher is at home instructing kids in the class, or we just don't have the staff for that at this point?
We do have that capability, and some teachers have, if they've been able to feel okay in quarantine during their quarantines. So that's definitely a possibility. But again, we want to make sure, part of this is because of the staffing issue, and we're very concerned that we're not going to have anybody in a few weeks if cases go up. So, but yeah, Mike, we would allow for that for sure.
Thank you. I just wanted to make sure we have that capability.
One more thing I just want to add, excuse me, I'm sorry, Ethan. One more thing I wanted to add was if we eventually go back, that a plan is in place where we can be able to flip over and go Google Classroom and eliminate these snow days that we still are having. I'd like to see, we're set up virtually, we're set up Google Classroom. We need to figure a way, once we are back in school, to be able to quickly transition and eliminate all the snow days going forward. I get if it's a big storm like we had. Day number 2, though, figure it out. We got to figure that out so that we don't have so many snow days carrying forward into the rest of the school year if we're back in. I'd like to see that happen.
Yeah, and Jeff, we've been working on that. Again, we've been discussing some of all the details with the association and administration about how to present those instructional hours to our kids and have it qualify for, at the state level. So that's actually part of the agenda for our next meeting. And we'll be discussing that and hopefully have that ready to go as soon as possible. Now, again, this year is a little bit different. We could utilize those days as we see fit, or even those partial early dismissals that we're looking at for staff development. But moving forward in next year, the limit is 5 days per year that you're allowed to use for those, and the state calls them flexible instructional days, and we're not calling them that this year because of the circumstances and working out some of those details. We're looking at calling them alternative learning days, which would be asynchronous days that the faculty would have office hours throughout the course of the school day, and then students would have an opportunity to complete the work throughout the course of the day. But if for some reason they lose internet or something happens that they're not able to get the work done on that day, they have a few days upon their return, whenever it is we return to school in person, to complete the work, which would count for attendance then. So that's kind of what we're looking at. And I believe I did send that information to the board for review.
I didn't see that, Matt. That's why I'm bringing that up again. I did check, and maybe that's something I missed, but I'll look for that again, and that'll be good if we see that on the agenda coming up. Great, thank you.
Yeah, I'll send that out again just to be sure.
I have one other question, Matt. At the last meeting, the Department of Health and PDE recommended we go virtual because we were in a substantial, correct? So that's still their recommendation?
Yes, I mean, that's been the recommendation.
In other words, that still stands. In other words,
Correct. So and we're still in substantial. I believe it's the fifth week in substantial. Right. Now, the but they put it on local decision to determine what the course of actions
But
are.
we discussed that last time. In other words, if we say no, or if we're going against their recommendations, right? And that could have legal ramifications. On the other hand, perhaps because we're talking about going 1 week or a week at a time, until we say we're going to go back and not be virtual. I guess, let me rephrase it another way. If we vote tonight to do 1 week at a time, we're still following their suggestion until we say we're not going to be virtual, correct? Or not?
That would be correct, yes.
I'll make a motion that we remain virtual.
Rick, hold on 1 second. Rick, can you
Sorry.
hold on 1 second before you make that motion?
Yep. Yes,
Matt,
yes.
could you just touch base? Because I know a number of people have been contacted by the buses. Could you maybe just clear that up for us about the pay with them going virtual? So we're all on the same page?
Absolutely, yes. So there's a webinar on January 6th that we're assuming that we will figure out what the formula is that the state is putting out that will allow us to pay our contractors for the services, even though we're virtual. So now the last week and a half, I guess, in discussions with Rose and other districts around us and what they're doing, we decided, because we don't know what that percentage is going to be, we thought it would be fair to at least provide the contractors with 50% of what they normally would get, and then reimburse them the rest thereafter once we are able to know what the formula is. So what we don't want to do is overpay when we shouldn't have, and then wind up asking for money back from the contractors thereafter. So we don't know legally what it is we're going to be allowed to put out there at this point.
Great. Thank you so much, Matt, for clearing that up, because I know a bunch have had questions on that.
I did have one question come in. If you'd like me to read that before we go into the vote.
That would be great, Rose. Thank you.
We had a question from Allison, and it is, where or when does the hybrid model fit into the plan moving forward?
And I think that's a great question, because that was what I was going to ask next. Is we have it in place. We've had it in place since June. Is that an option that we could do that? Or would it still be an issue with staffing?
It is, but yes, Bernice, that is a concern as well, is the staffing issues. And even with the small number of students coming into the building, I know, a couple local districts that did go virtual and bring in some, select groups of students, wound up having to close down anyways because of how quickly it spread and the requirements to quarantine. So that's why we're recommending the full virtual at this point, is to give everything time to settle down. But if at some point we believe it's safe to, even if it's not to go back fully in person, that we do have that hybrid model ready to go at any point.
Okay, great, Matt. Thank you for that. So staffing is a huge part of this as well.
Yeah, we struggled the last several weeks to maintain, keeping buildings open has been frustrating, to say the least, in a tall task that.
Right. So even if we were to go back, we're not guaranteed staffing.
Correct.
Would that be correct, Matt?
Yes. Yeah.
Okay.
So Attorney Mayor, this is Bill Hiroshi. Can you confirm that doing this 1 week at a time makes us within the recommendation of the Department of Health and PDE?
Yeah, Bill, we've discussed this in the past couple meetings. I mean, the PDE and the governor has essentially said, we're leaving it up to you guys. Each
Right.
situation is different, so they're gonna do a case-by-case district basis.
Right. My question is, when we met last month, or not, well, actually, it's this month, earlier, the suggestion was made that if we said we're going to go back, which we did, without that, we were risking possible lawsuits because we were saying we weren't following what the Department of Health and PDE suggested. So now they're still suggesting that we are virtual. We go virtual because we're substantial. So if we, obviously, if a motion is made and we vote to have a week of virtual, we're within those guidelines, right? And then the following week, at the end of that week or whenever we decide, suppose we decide after that first week that the second week that Matt was suggesting, the second week we will go back, then we are not in accordance with the suggestions of the Department of Health and PD, correct? Am I correct on that? In other words,
Yeah, I understand your line of thinking. I think that if we're gonna be discussing any liability issues or lawsuits and stuff, that should be something that could be done in executive session regarding litigation. But what I can tell you, Bill, is that it's a recommendation, so it is not an order.
Yeah,
If the governor had ordered us to close and the board voted to stay open in person, then we could be in trouble.
Right.
Does that make sense?
Yeah, of course it does. Yeah. Well, I think at the last meeting, it was said, even if we go against the recommendation, of course, in the United States, lawsuits are possible. You can sue anybody for anything. So I think the term last time was something to the effect, if somebody is injured, that is, if somebody becomes seriously ill or otherwise, somebody could say, well, you didn't follow the recommendations, and therefore that's why this happened, and we're suing you. So, just with that in mind, we're apparently, the majority seems to feel, from what I sense now, that we're going to stay virtual for at least the first week, which puts us within the guidelines. So then if the second week we don't stay virtual, we would be going against the recommendation, right? That's correct. Yes? I think that's what you're saying.
I don't want to confuse recommendations, right? So the
Okay.
governor's recommendation
Okay,
is that,
okay, I thought it was the Department of Health and PDE recommended that we go virtual. Wasn't that what we were told last time?
I believe so. Matt, Dr. Barrett would have to clear that up.
Okay.
I'm not
Yeah,
privy.
that's
I'm not
correct.
privy to those.
My impression was that the Department of Health recommended that we go completely virtual and for the rest of, until Christmas vacation, and to see what happened afterward, correct? That was the recommendation. And the Department of Health and PDE both recommended that. Matt, I think that's how it was stated, wasn't it?
Yes, that's the recommendation, yes.
Okay, and that recommendation is still there.
The recommendation last in any county that's, or any district that's in a county that's designated substantial.
Okay. So if we go a week virtual,
Okay,
we're still within the parameters of their suggestion.
Yes,
That's correct, Bill.
yes, you're correct, Bill.
We would be
Yeah.
in line with their recommendation for sure.
We're following the recommendation.
We
I'll
don't
make a
follow-
motion that I
We
move
don't follow
that
the
we,
recommendation when we decide, if we decide to do otherwise, then we're still substantial. Okay. In other words.
I move that.
Now,
Correct,
excuse me.
just like we did the week prior.
I apologize for interrupting you, Rick.
No,
Just to make clear, in
No,
other
go
words-
ahead, but I was just trying to explain, just like we did
Yeah, I just want to make that.
the week prior.
Oh, in
We
other
went
words,
against the recommendation.
right.
Yes,
So
that's clear.
if after the first week we meet again, and then we decide we're going for the second week, we're going to go back, then we're doing it against the recommendation. Okay,
Yeah, but I have a
Correct.
question on that.
just so that's clear.
Down within the next 2 weeks, the numbers could go
Well,
possible.
of course they could. Yeah, well, it all depends. Yes.
Right.
What the numbers are, of course.
That's correct. So if the numbers go down and we fall into moderate or low, then
That
you know,
changes everything, yes.
correct.
And not only that, as of January 6th, you'll have more information on the vaccination, which is great news. So that's even better.
As well as whether there's a surge after the Christmas surge, similar to the Thanksgiving surge. So we'll see. Hopefully it won't be. Hopefully it will be down. Okay.
I move that we remain virtual, fully virtual through the week of January 4th at this point.
January 4th to the 8th.
Yes.
I'll
Okay,
second.
January 4th to January 8th.
All right, so that motion was made to stay virtual, January 4th to January 8th.
I will
Was
second
made
it.
by Mr. Hoke and then seconded by Mr. Wood. Are there any other questions or comments on that? Okay, hearing none. Rose, can we have a roll call vote for that, just so everyone's clear?
Yes.
Okay,
I have
Mrs.
a question.
Fiorella? Oh, is there a question before that?
Yes, I have one. Is Mr. Enslin, I have a question. Matt, does
Yes.
this motion fall within your recommendation?
It does. Yeah. I mean, if we take it week by week, you know, the goal was to go virtual, you know, based upon the guidance we received. And, you know, if the numbers still aren't there, I'll recommend another week thereafter. So, you know, I was giving the 2 weeks guidance based upon what we've learned, though. That's it. But yes, I mean, it's still, you know, would fall under, the point is the recommendation's virtual, and we're doing that for at least a week.
And we'll revisit on
On the
or
6th.
about January 6th.
Yes.
correct.
Thank
And
you.
I think that's a smart move. Numbers could be great and we could be back in. Numbers could be bad and we're another week virtual, but I think it's smart to take it a week at a time. Okay, so Rose, if you want to go ahead, are there any other questions? Okay, Rose, if you wouldn't mind doing the roll call vote, that would be great.
Yes. Mrs. Fiorella?
I'm a yes.
Mr. Hoke?
Yes.
Mr. Gogalski?
Yes.
Mrs. DeCiato?
Yes.
Mr. Enslin?
Yes.
Mr. Gershi?
Yes.
Mr. Gambita?
Yes.
Mr. Auckland?
Yes.
And Mr. Wood?
Yes.
Mrs. Fiorella, you have 9 yeses. The motion carries.
Jeff,
Okay.
you said you were going to keep a little bit of an eye on the numbers. Will you please keep us all apprised as to what you see? Then we'll have one source instead of multiples to keep track of where the numbers are at next week or the following.
Yeah, that's fine, Rick. I'll start as of tonight, and it's going to be just in the Western Wayne district zip codes. And Mr. Gershi, I understand it is carrying over to others, but we'll just hit the ones that we know are in our district.
There's a lot of overlap into Lackawanna County, like Massa.
No pressure, Jeff. Your
Thank you, though,
numbers
Jeff.
better
I
add up.
appreciate it. That helps us at least get a continuous and one source. I'd appreciate that. Thank you.
Okay. Is there anything anybody else wants to say, Matt? Anything? Okay. Can I have an emotion for adjournment?
Motion to adjourn, Madam President.
Okay. That's it, everyone. Thank you, folks. See you next
Thank
time.
you,
Happy New
everyone.
Year, everyone.
Happy New Year.
Happy New
Enjoy
Year.
your evening.